Hello.
Hello.
Thank you for this arrangement here of flowers and messages. I was very taken by this, and I can see other people are as well. It is a manifestation I recognize in honor of those who are going to die without help, and in the name of those who are going to pay with their lives for this herd immunity strategy. And there are a lot of calls for compliance with international human rights law. The most severe one is Stop the Genocide, and the UN Convention on Economical, Social and Cultural Rights, of course, the Universal Declaration on Human Rights, and I have been communicating for a few weeks with the UN Special Rapporteur on Torture, Professor Nils Meltzer, and the former Special Rapporteur on the Human Right to Health, Professor Paul Hunt, and a number of medical specialists who are working with international human rights law, in particular torture, ill treatment and the right to health. And I've tried to create an awareness of this apartheid strategy in Sweden, which is dramatic. There is a huge difference in between how Sweden and its neighboring other Nordic countries are handling this situation. And with this interest of mine, I would like to ask you a few questions. Would you like to help me? So can you tell me how come that all these flower arrangements and witness statements about losses of human beings now in Sweden, how come that they have ended up here together?
They ended up here because at the beginning of this whole crisis in Sweden, a lot of people were feeling hopeless and they didn't know who to turn to. So we started arranging Facebook groups so that we can support each other and we can decide what to do about this. And then we got many ideas and many of them didn't work, and then we decided that the most important thing for now is to demonstrate and try to make people aware of the consequences of this whole thing, because we think that it's not worth it to sacrifice human rights now just for the sake of being able to go and eat in restaurants and coffee shops, for example. So we want to have like a demonstration a little bit about different things like human rights, and there's also things about the specific people who died, and it was just a way to show our discontent.
Yes, and what is it in this strategy, this very unique Swedish strategy to deal with COVID-19? What is it that you are critical of, and what makes you invoke international human rights law?
Yeah, we are critical of so many things. Like, for example, that families are still forced to send their kids to school.
Yes.
And they are being threatened now because they are keeping their kids at home as a preventive measure. So the schools are threatening them that they're gonna report them, and many parents still decide not to send them, and many others maybe do, even though for example, many people are sitting at home with cancer. And they think like this: if I get COVID-19, I will not survive. My kid needs to go to school, what should I do? And they are too scared, and they send the kids to school because they don't want to be reported, and they don't want to be in the situation that they're going to end up having lost their kids. So they take that risk. For example, that's one thing. The schools are open. It's like a tragedy for many families, a very big stress factor. And we are very critical of, for example, the guidelines that we have to follow in Sweden right now, because as it is now, we take how to say that, It's like
bellyache or stomach sickness.
Yeah,
perhaps.
exactly, stomach sickness. We take that more seriously in Sweden right now than COVID-19. In fact, it's
Yes.
that was in Swedish. Yeah, it's like that's just how it is. Because if someone has stomach sickness in my family, then I have to stay at home, even if I don't have it, to prevent the spreading. That's how it is in schools right now. But in COVID-19, it's not like that. The whole family can be lying at the hospital with COVID-19 confirmed, and the kids are still required to be in school, for example, if they don't show symptoms. So,
Have you heard of any possibility to escape this? I have previously, just a few days before the strike of COVID-19 in Sweden, I was talking to Jonas Himmelstrand, who is has been working and reporting also to the European Court of Human Rights about the situation for children and parents who wants to take care of their children without interference by the authorities, and who has taken refuge in other countries, like in Canada, in Finland, where people are not forced with such coercion as is used in Sweden to send their kids to school. And they had refugee routes over to Åland in particular, where they could bring their children. Have you heard of any possibilities for parents to escape this?
nah, no. It's what they are saying now. What's coming from the government right now about the situation is that now the parents can have possibilities of distance learning if the kids need to be at home because they have symptoms of COVID-19. Only if they have symptoms. So
Only if they have symptoms.
exactly.
Yeah.
So then of course that many parents are gonna lie. Of course, that's obvious. They are already lying. And people can stay at home for 21 days now without any papers from the doctors. So at least those 21 days they have, if they are willing to lie then. But they are not coming with any solutions at all for parents who just purely don't dare to send their kids to school. Those parents, if they admit that my child is healthy but I want to keep him at home, then they don't have any right to keep them at home.
Yes, and did I understand it correct that you are working in school yourself?
Yeah, in a preschool.
In preschool?
Yeah.
Yes.
So the rules there are different because
Yes.
it's not mandatory.
Yes. But it's a little bit of the same situation with that parents are still maybe forced to leave their kids because they still have to work.
Exactly. Exactly.
Yes.
That's a big problem.
And how do you personally feel about the risk for yourself?
I feel very bad. I always say like this, that I would not mind that much risking if I knew that I was really contributing to the that I was contributing for example parents who are doctors or nurses, that they really need to leave their kids there. Then I would at least contribute enough. But as it is now, I'm taking care of kids whose parents are sitting at home and they are having like a baby, for example, so they are anyway at home, but they can still leave the kids there. Or parents who don't have a job, they are unemployed, they can still leave their kids there. Parents who are studying from home, same thing. That's how it is now. So it doesn't feel safe, and it doesn't feel safe for the kids either, because we cannot pretend that we can ensure the security of the kids, because we cannot. No one knows enough about this virus to know if it's safe in schools or not. And we of course cannot have appropriate distances in school, and especially not in preschool, because we need to help the kids with everything. So the guidelines from the government don't apply to us at all, because it's impossible, it's unreal.
I was thinking, what could you hope for, or what do you wish to accomplish with this message? If what you're telling me here now gets heard by maybe representatives of the United Nations.
I hope so.
Yes. What would you like to tell them, or what would you like them to do?
I would like them purely to do everything in their power to help us, just help the people in Sweden right now because we feel that no one is aware of our suffering actually. We feel that this is such a scandal that is happening. This is actually happening in Sweden right now. They are totally torturing us in such a way that it's so subtle, but it still affects so many people. And we feel that had this not been a global pandemic, this would already be an international scandal. But since all countries are dealing with their own problems, we are being forgotten. But we need help here. We need, if nothing else, we need people to pressure the Swedish government because they are the ones responsible for this mess.
To that problem is what you just said, that the government is responsible, and that is also the view of the international experts, and that is the rule under international law. But what they say here in other cases, and this is very well known to in particular Mr. Nils Meltzer, is that they are not allowed to interfere with the activities of their authorities, like Folkhälsomyndigheten. That is what the government is saying.
Yes.
And they say that even in very serious cases where they're required to prevent torture and prevent killing people, but they still say, no, we're not allowed to interfere with our authorities.
Well, but that's a big problem, isn't it? How can that be? How can that work like that? I mean, if it is like that, then that has to be changed, right?